Hey, hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for today's webinar, Part 2, Under the Hood, Building Your Own Plan Selection Tools for 2024. My name is Aisat Odiale, and I'm the Health Projects Assistant at the Center on Budget and Policy Priorities. I'll be moderating today's webinar. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center on Budget and Policy Priorities is a nonprofit policy organization. We are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar is not intended for press purposes, and while we hope you will learn a lot, we are not able to offer continuing education credit for our webinars at this time. Here you can see our upcoming webinars. We are excited to give you a sneak peek of the dates and topics for our annual fall webinar series starting next month. We'll cover the core concepts we always do, like determining household size and income, premium tax credit eligibility, and resolving data matching issues. And we're also adding some new content on immigrant eligibility, and are pleased to once again be hosting a webinar in Spanish that focuses on enrollment issues most relevant for people who are immigrants and people who live in mixed immigration status households. Automated captions have been enabled for this webinar. To view them, click on the More option with 3 dots at the bottom of your screen. There you should have the option to turn on closed captioning. All participants are muted and in listen-only mode. If you'd like to ask a question, click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will pause for Q&A during the presentation. We may not be able to answer every question asked, but we will have a record of all of your questions and will use them as a guide for future resources and presentations. And of course, you can also email your questions during and after the webinar to beyondthebasics@cbpp.org. And a quick reminder that you won't be able to click on your screen to go to any links shared in the deck, but I will put the slides in the chat where you can find all active links to everything shared in today's webinar. Our guest presenter is Arianna Anaya. She previously served as a certified application counselor, community health worker, and navigator in Texas and Illinois between 2014 and 2022. In today's webinar, she will discuss researching your market, the shopping tool, building network overviews, and building plan comparison resources. But before that, Jenny Sullivan will briefly discuss new data on marketplace enrollment in 2023.
Great, thank you so much, Ayasat, and good afternoon, everybody. Before we get into the main event this afternoon, I just wanted to briefly share some new data that we just got late last week from CMS, and I'll go ahead and put the link to this in the chat. There it is. And what this is the effectuated enrollment snapshot. So you'll recall that people can go through the enrollment process and they select a plan, and that's the number that we get in the weekly snapshots during open enrollment. And then we have this big drum roll at the end, and X million people selected a plan, but we don't know how many people then went on to pay their first month's premium and effectuate that coverage. It's usually a good majority of the people who selected a plan, but obviously that's really the number that matters. Those are the people that are actually getting coverage through the marketplace. So just a quick recap of what the report finds for all states, but I'll note that if you open the PDF, you can see individual data for every state. So you can look up exactly what the trends are where you live if you are so inclined. And that includes both FFM, federally facilitated marketplace states that use healthcare.gov, as well as states that run their own marketplaces. But overall, across all states in DC, as of February of this year, there was a 13% increase in marketplace enrollment compared to the previous year. There was a 15% increase in the number of people with premium tax credits and an 11% increase in the number of people with cost sharing reductions. We knew that these trends were true, certainly looking at the end of open enrollment snapshots, but again, it's good to see them carry through to actual people who have been sort of verified to be receiving coverage. Finally, no surprise here, but premiums are a little bit lower this year than they were the previous year, again, because as the premium tax credit enhancements continue that started through the American Rescue Plan Act and were extended last year through the Inflation Reduction Act, which is celebrating its 1-year anniversary this week. We have seen, or marketplace enrollees have seen, lower premiums. So 3% lower premiums after the tax credit as of February this year compared to folks who were receiving coverage and receiving tax credits in 2022. Again, the link is at the bottom. You can check out how your specific state is doing there, but just wanted to make sure that you had the latest, greatest at your fingertips. And with that, I am going to turn it over to Arianna to get us rolling. Thanks.
All right, great. Thank you so much. Let me quickly bring up my portion of the PowerPoint. Okay, there we are. So just to get started on building resources for your market, we wanted to talk a little bit about the shopping tool, which I'm calling your friendly neighborhood shopping tool. In my mind, a lot like Spider-Man, in that it's complicated. The shopping tool I find to be one of the more helpful elements of healthcare.gov and of the various state-based exchanges, and a very, very important tool if you or your entity is endeavoring to build concrete resources that give overviews of the different QHPs. But it is a double-edged sword in that these tools have rules for how they need to be used. And so I wanted to start by going over some of the things that the tools have in common across the board, and also some of the ways in which they differ, just so we're mostly on the same page about a tool that we have in common, regardless of what market we're in, but also the fact that that tool has its own finicky elements. So we have a couple of screenshots from some of the different state-based exchanges, and of course, one from healthcare.gov. Before I get into going through some of those different tools and their differences and their similarities, I wanted to make sure you guys were all aware that the tool containing links to the shopping tool for state-based exchanges has been updated beautifully by Set. There are links to the actual portion of the state-based exchange where you can easily access the shopping tool and then take a sort of unfettered look at what your plans look like for now. Now, most of these links will stay the same for 2024, but we will do our best to get this updated because sometimes there's a bit of a shift. So that tool is linked within the slides. Some of the tools, depending on your market, depending on your state, might be very obvious, and some of them are a little hidden. So we wanted to make sure that everyone has that access and can locate that tool in order to play with it. So just to get started, as I was playing with different shopping tools in different states, something that has really stood out to me repeatedly, and something that I think can be a detriment to clients, is that there is this requisite that pretty much every single tool I've noted has in common, which is a client needs to put in information in order to get information. And what this reminds me of is my early days of being an assister when the ACA had first rolled out. And I would be in all different kinds of locations. I would be in churches and community centers and mosques. And people would walk up to my table and say, "How much is Obamacare?" And man, did that question eventually come to irk me, because it's impossible to answer without certain demographic information. And of course, if you've been assisting for at least a little bit, you know that you need to know some minimums in order to give someone a sense of what plans they're eligible for. And I've laid out those minimums on the right-hand side. There's a commitment that a client has to make, or that you, if you're using the tool to look at different plans, has to kind of make when it comes to getting any information. You're going to need to provide a zip code that's representative. I always recommend using the zip code of your center or of your site, but this too can be tricky if you serve a major metropolitan area. You might need to use a couple of zip codes. You're going to need to pick an age of an applicant. So if you're working with an actual client, this is easy, but you want to be aware of the fact that different aged clients may have different eligibilities, and I'll talk a little bit more about that later on. And then finally, of course, to get a sense of what the costs may be when it comes to premiums, but also when it comes to cost sharing reductions, there's going to be a request for income or an income estimate. I was particularly enthused with Maryland's shopping tool because it had these little boxed explanations. That's what the screenshot is to the left, that offered brief but not inaccurate explanations, which I found really nice. Be aware, depending on your market, depending on your state and your tool, sometimes additional applicant information is requested. I've seen tools that request a name of different household members, which may seem a bit off-putting, but the idea here is the tool might be a bit more complicated and might be endeavoring to sort of track costs for different people. Again, though, if you are simply using the tool to get a sense of your market, just go with a household of one for the most part. It'll make life easier. Certain tools will ask for a date of birth. You can make up a date of birth if you're just using the tool to shop. Sometimes they will ask for the sex of the applicant, the pregnancy status, whether or not they're a tobacco user, and whether or not they're an American Indian or Alaskan Native. Now, a lot of these items, even when they are requested, can be skipped, but just be aware that each of those pieces of information may impact what plans look like when you actually get to them. So it's often a good idea to design a sort of quote unquote basic client as your standard person when you are using the shopping tool to look at plans. So where the tools differ in a big, sometimes very surprising way, is how many screens it takes to get the information that's necessary before you can get any information on plans. Again, Maryland just had the one screen, which is kind of nice in certain respects. Healthcare.gov has quite a few. I want to say at least 5 and 6, and some of it feels a little redundant. You'll notice at the bottom of the screen, it will say, want to skip these questions. And I've seen this with a lot of shopping tools where they often kind of say, let's just show you plans and skip the questions. And this is fine if you're cognizant of what this means. But note, if you skip to see plans now, we'll show you prices based on a person who's 35. So that's all well and good, but it's going to be a person who's 35 and we don't know what the income is that healthcare.gov is going to show us. Well, we do if we've done this before. But be aware of the fact that sometimes the enticements that the shopping tool may provide to just skip or to just move quickly through the screens might mean that you don't have good control over what plans you're being shown. You want to make sure from the get-go, if we're using that shopping tool to look at plans, that you are very clear on who you're using as a kind of pretend client and what that will help you look at as you design resources to help you with future clients. So something that the shopping tools tend to have in common, I have yet to find a shopping tool that doesn't have a filter. I'm sure I'm going to get an email from one of you immediately telling me that there is a shopping tool that has no filter, which will bum me out. But so far, every single shopping tool I've played with has a filter, and they tend to have a lot in common as well. I find the filter tool to be very, very helpful for designing any sort of resource. Now, again, you want to keep in mind that if you look at this now, you're looking at 2023 plans, which is a great time to do it. But to prep for open enrollment, you probably want to wait until about the end of October. Typically, the 3rd or 4th week of October is when plans will make their appearance and when they'll actually show up within the shopping tools. So the filter tool for healthcare.gov I find quite helpful. It's right at the top of the screen. And if you pull it open, it's going to give you some helpful information. Right off the bat, you can see that it lets me know that there are catastrophic, bronze, silver, gold, and platinum plans. If you're in a market that doesn't have platinum plans, or if your search function excludes a client eligible for catastrophic, those plan categories won't show up, which can be helpful for mapping out your market. Likewise, the circled category is the different plan types. This is very helpful information to know right off the bat that your market contains EPOs and HMOs and no PPOs or POSs. I've sat down with so many clients in Texas who say, well, I want a PPO. Sometimes it's helpful for me to let them know right off the bat, unfortunately in our market, you're going to need to choose between an EPO or an HMO because we don't have PPOs or POSs. So having that information from the filter tool and incorporating it into your directory, or your network overview, can be a very helpful thing. And then lastly, how this appears in other states' shopping tools depends. But so far, I've seen that most of them also list the insurance companies. It may not tell you how many plans each insurance company offers, which is a very helpful thing, but usually you can kind of reverse engineer the filter tool to give you that information as necessary. But right away, just with a massive number of plans, I want to say this is Florida, you have all of the following information right off the bat, just from the filter tool. Now, this is, of course, assuming you had the patience to go through the client info questions and you're getting an accurate read of plans that are representative for that specific area. But this is information that can be very readily transformed into a network overview tool. So one thing to be aware of is the filter tools may have very differing functionality. And what I mean when I say that is, obviously technology is a wonderful thing when it works, but when you don't understand how it works, or when it's esoteric, technology is sometimes not very helpful. There's not always a lot of how-to explanations on the internet for how those tools themselves are designed to work. So I'll use as an example, I've actually never, before I pulled this open, looked at the state of New York's health exchange. But what the shopping tool is right up front, which is a lovely thing. I put in a zip code and indicated I wasn't a robot. And then I saw 46 pages of plans. And I am usually a little shell-shocked by New York City. I'm a bit of a country mouse, but that surprised me because if we have 10 plans per page, 46 pages means 460 plans, probably not quite that, but let's say 400 plans. And that really shook me. Happily, I played with the filter tool a little more and came to realize that actually New York's tool is quite helpful if you know how to use it. So if everyone can see at the top that I had, just by entering a zip code, indicated the county of New York. But what I hadn't done, I hadn't indicated persons covered, which you can see with that little teeny asterisk is kind of required. So I was very excited to figure out that if I in fact indicated some specific group and I went with individual, it reduced the pages of plans from 46 to 12. So that brought me to a much more reasonable plan count of 120 at the max. But again, if I had just looked at that 46 and panicked, and you can imagine a consumer doing that, this tool would have not been very helpful to me. I needed to do a little bit of investigative work. What I also discovered was if I went to that coverage type and indicated medical, it would actually kick out a bunch of dental plans because the New York shopping tool functions a little differently than some of the tools I've worked with. And so dental plans are actually listed within the medical plans here, which I have seen with some of the other state-based exchanges. So this brought the plan count from 460 to 120, now to a much more moderate and sort of reasonable 80, right? 80 is still a lot of plans, but it's manageable as opposed to that initial count. So be aware of these quirks of your shopping tools, not just for yourself when it comes to building these types of resources, but because often clients have tried to look up this information themselves, just like I used to get yelled at, hey, how much is Obamacare? And when that information isn't readily available, it can be very discouraging. So helping people know how to look stuff up will help you, but it will also help your clients. And then, of course, the all-important end goal here is the potential to move towards building overviews of your specific market that can serve as a kind of cheat sheet or a quick way of helping a client orient themselves to what's available, as opposed to forcing them to go through, 120 to 80 to however many plans are available. So this is a resource that I've long sort of tried to share out, and it is available. With this layout, we would want no more than 6 companies. This I'm going to call hot dog style, versus this is hamburger style, where if you've got quite a few more companies, you've sort of got to use as much space as possible to list them out. So there's an orientation here that makes sense, but these templates are available to all of y'all. And if you ever would like assistance or have questions about utilizing them, that's what I'm here for. So just keep in mind the function or the point to some extent of ensuring you guys are aware of the benefits, but also some of the quirks of these shopping tools is this end goal of building some marketplace overviews that can help you when it comes to the open enrollment season and helping clients with plan selection. I also want to emphasize something that keeps occurring to me. I have a tendency to over-design things, which doesn't really make sense because I don't have any background or experience in design at all. But very often when I was first getting started and, I worked alone for a long time, I was sort of part of an entity that sent each of us as sisters to different locations. I used a hand-drawn, and I tried to find a photo of this, but I couldn't find it. I hand drew this often just because having like this pretty version wasn't as important as having a working version with information. But again, it's always going to depend on whether this is something that you build for yourself or whether your entity can kind of galvanize support from the other sisters and y'all can put it together and fact check it as an entity. But I think you don't need to have a fancy pants version if working in Excel drives you crazy. And frankly, working in Excel sometimes makes me very mad. Use whatever makes the most sense. It doesn't need to be color coordinated. There's no real function to that beyond, my failed art school endeavors. Like, do what makes sense. The information is what matters. And just to kind of make sure that you have this information as well, there's a section of the overview that I always emphasize, where I encourage assisters who are building these resources to include the plan type offered by each company. Because sometimes the company will offer more than one, and it's very important that the assister and the client understands the difference between, let's say, an HMO offered by Blue Cross Blue Shield and maybe a POS offered by Blue Cross Blue Shield. But the trick too is the definitions of what plans do and their type can be a little bit shifty, right? We have some markets throughout the country that don't have any PPOs or don't have any POSs. And then we have some that have all 4 plan types. But the challenge, I think, is that often the definition of what an HMO is versus what a PPO is, it might be meaningless to a client because all they know is that they've heard that an HMO is a bad thing, right? Americans know, I think, across the board that HMO is sort of a bad word, when the reality is an HMO might actually suit the needs of many clients much better than a PPO or a POS. So being able to identify for a client what a plan is and what that means for their usage is so essential, especially if a client has come off of Medicaid, which is often quite forgiving as a program. An HMO will work just fine, but it is not forgiving if you misuse it. You must follow the rules for it. And in fact, that's true across the board of health insurance. It's not really set up to be forgiving or to accommodate user error, right? It's set up to not cover costs when people don't follow the rules. So this is a resource is kind of funky because it does try to accommodate the fact that there are HMOs that don't require a referral. But usually the definition of an HMO is that it requires a referral. So providing this information within the scope of your network overview can be very, very helpful as a reminder to you and as a reminder to the client of the sort of realities of plan rules. And just to show, because this comes up a lot for me, I keep seeing HMOs that don't require referrals. If you are working within healthcare.gov or if you're working within your state-based exchange and you're trying to see whether or not an HMO is in that category, what you want to pull open is the summary of benefits, which on healthcare.gov is a little tucked away. Actually, on most of the state-based exchange, tend to be a little tucked away, generally under the category of plan documents. So if you're at the main screen on healthcare.gov, pull open plan details, scroll until you see plan documents, and then within that, the summary of benefits will be available. Summary of benefits are complicated, and most important to know, what's most important to know about them is they are a summary. They are not the complete contract, but they're usually organized in a pretty standardized way, which is wonderful for clients. It's a lot of information, but at least if they can make sense of a summary of benefits, they can probably make sense of any summary of benefits because they tend to be organized the same way. So generally speaking, if you're pulling open the summary of benefits for an HMO to see whether or not it requires a referral, you want to look at the bottom of the first page. Sometimes it will bleed onto the top of the second page, but generally the first page, bottom of that first chart, will answer and will ask and answer the question, do you need a referral to see a specialist? And you'll note for this specific plan, which is a Baylor Scott and White plan offered out of Texas, it's actually an HMO that surprisingly does not require clients to get a referral to go to a specialist. So in certain respects, it's like this is an EPO, right? But don't say that because it's an HMO. However, your network overview tool can indicate it is an HMO, but one for which a referral is not required. So that's where to get that information. Okay, we're gonna quickly pause before we move further. And ISAT is going to do a poll, I believe, if you guys don't mind participating. This really helps us understand what support y'all need when it comes to this type of enrollment work. And then we'll see some questions. So if y'all don't.
Thanks, Ari. Yeah, I just launched the poll, which everyone should be able to view and answer. So we're going to take a moment. Okay, we're at like halfway participation rate, so just gonna give it a few more moments to let more people answer. Okay, great. And Ari, are you able to view the poll?
Interesting question. I don't know. I'm sorry to say.
Okay, I think it will be saved for us to view and to follow up if needed.
Do you want to share those results orally then, I said, if people can't see it? I don't know if everyone can see the results.
Yes. So just for everyone, the question is, do you currently use any kind of marketplace network overview resource for the geographic area you serve? And currently 58% people say no, 9% say yes, I created myself, 16% say yes, my organization creates it for me, 13% says yes, the enrollment coalition in my state or region creates it. And then 3% says, yes, I get it from a different source rather than B, C, or D.
Oh, I love that. Okay.
So I'm just going to end the poll and get into a couple of questions that we have. Thank you everyone for participating. So the first question is, people often see dental in a plan name and assume it's good dental coverage, but that isn't always the case. How would you recommend navigating choosing a medical plan?
I always, and I think it's very important to recognize dental and health insurance as completely separate products in many respects. The same kind of holds true for vision. The Affordable Care Act regulated medical health insurance. I am not in any way going to say anything about whether dental should be included. You know, this has been decided by people much more important than me. But medical health insurance is what the ACA is sort of about and what enrollment assisters are usually focused on. But clients are very excited, I think, about dental and vision for whatever reason. Perhaps, I don't know why. But dental insurance tends to function a little bit more like a discount, and it doesn't have the protections or guarantees that health insurance plans have. So what I've always advised is, if somebody needs dental insurance, this is really kind of a separate conversation than having a conversation about medical insurance. It's like if someone showed up to learn about cars and then wanted you to explain to them about shower heads. It's just a very different product. And no one should ever pick a medical insurance solely because it has dental insurance. That doesn't make any sense at all. You can buy dental insurance year-round directly from dental insurance companies. You can get help with that from a dental office very often because they contract with dental insurance companies. But I think conflating the two products tends to really make life harder for clients for a variety of reasons. So I would always advise, if they happen to want that health insurance and there's a dental buy-up and they're like, cool, so I'll get a bit of a discount on my cleaning. Sounds good. Okay, get that medical insurance, but do not buy a medical insurance plan because it contains dental. Dental insurance is inexpensive. You're not going to get any financial assistance from healthcare.gov with it. There's no reason to conflate the two products.
Thank you, Ari. That was a very detailed and helpful recommendation. So another question before we continue with the presentation is, I live in a state with a lot of plan choices, 91 silver plans alone. So any tool we create is going to take a lot of work. If we only have time and capacity to create one resource, what do you recommend?
This is such a good question because I've been thinking a lot about my sort of manic approach to detailing every plan. And I don't think it's helpful for anyone. I don't think it's helpful for clients. And I think it's a lot of work for assisters who already have too much work. I'm starting to think about potentially a focus on, let's say, a targeted or strategic focus on the least expensive plans in each category. And it's something I'm actually going to talk about a little bit later on. More than anything, however, I think now that we have standardized plans in healthcare.gov, and with that, the ability to use them as almost a sieve through which to shift through as many silver plans as there are, I'm wondering if there is using the network overview, which again would look at the companies as opposed to the individual plans, and then using those standardized plans almost as tent poles or signposts. If there's a better way to deal with the enormity of choice that consumers are confronted with, because I really agree that trying to detail every single plan is just not an efficient or effective way to go. So I think the network overview is an effective way to go. I think that will help people cut down from 81 options to potentially, let's say, 40. I don't want that company because they're not in network with the hospital I need, right? That's a reasonable way to approach bringing the plans into kind of a normal level of choice. But I do also think focusing on the least expensive options in different metal categories and potentially not going so into the weeds of the plan details might be a better way to go as well. So it's something I'm going to definitely think about and work on. And any thoughts, feelings, any help y'all need with this as a project, be sure to shoot me or Beyond the Basics an email, because this is something that we're still evolving, and y'all have to be a part of it because it's for you guys.
Thank you, Ari. We're going to continue with the presentation, but if anyone has any more questions, please feel free to drop them in the Q&A chat.
All right, sounds good. Uh-oh, nobody panic. Okay. So I'm going to talk a little bit about building a network overview, and this is territory that I try and talk about a lot. So hopefully there are some tips within it. Hopefully I'm treading some new territory, but as always, feel free to shoot me an email if there's anything that I don't cover. I have kind of an overview of the general steps when it comes to how I approach this. I'm going to zero in on a couple of pieces, specifically catastrophic plans, and then also the provider lookup tool, because this, I think, across the board is something I have struggled with my whole life as an assister, and that I get feedback on a lot, where people are frustrated with the fact that often the tool that healthcare.gov or their state-based exchange uses to look up providers doesn't work, or doesn't work well, or worst of all, works sometimes. I find a tool that works sometimes might be more useless than a tool that doesn't work in certain respects, because you can't even count on it to not do well, right? You can't even count on it to offer information that works wrong for you, if that makes any sense. But again, these are my generalized sort of steps when it comes to using that shopping tool that we've discussed to build your starter overview. Okay, so to start, one warning that I made a bit earlier is you need to have control over who your fake client is if you're using the shopping tool just to look at or to build an overview. You need to be consistent, because changing the income or changing the age of the person will change the cost of plans. It also could change what plans are being shown. And as an example, on the left-hand side of the screen right now, if I had completed the shopping tool starter thing as a 38-year-old with $30,000 of income, I would see 109 plans. The reason for that is the 38-year-old is not eligible for catastrophic plans, okay? If I had done it as a 28-year-old, someone under the age of 30, you can see on the right-hand side, 113 plans show up. Now, this isn't really a big deal, right? I'm someone who will do this kind of a lot, and I usually don't spend a ton of time on catastrophic plans. But if you're endeavoring to take a look at all things being offered, right, it's going to be a little bit problematic that for one client, it's 113 plans, and for another client, it's 109 plans. So if you want to be accurate about the total number of plans on offer in a given year, look it up for the 28-year-old, because that will include catastrophic plans. The other piece I wanted to just briefly touch on is the tool that healthcare.gov relies upon when it comes to adding medical providers. There's also this add prescriptions, but if you're building a shopping tool, I'm going to assume you're not trying to look up prescriptions for those purposes, but certainly the prescription tool has its own challenges. However, what I've found, because I do rely upon the medical provider tool in healthcare.gov, and this is something that I do see some state-based exchanges have and some do not. But in theory, what it enables you to do is to add the names of providers or facilities, and each plan will show them as a yes or a no. Very tricky and very inconsistent, because you have to remember that healthcare.gov is essentially pulling information from the provider directory of a third party at this point. And we all know even the directory of a given QHP, not necessarily always the most helpful, but it can be a good starting point when you're just trying to get a sense of what your market looks like. So I think the trick here is trust but verify is what I'll say about this. Yes, use it, note it when you start to build out your overview, but just be aware this is not the best information. It's doing its best to be accurate, but it's very complicated how many sources it has to go through to get it right. So if you click on that Add Medical Providers button, it will take you to a screen where you can add the name of the doctor or the facilities. The name of the doctor I find very challenging for a variety of reasons. So I tend to use it for hospitals. And that's generally how I build my overviews, my directories, or my network overviews, relying on hospitals, because people tend to have an opinion about what hospital they want to go to. That can be a very important factor when it comes to plan selection. So if my overview tells me every single company, what local hospitals a specific company is in network with, that's helpful information for most clients. Now, I think I was somewhere in Illinois for this, and I knew there to be 2 hospitals in the area, 2 trauma 1, large scale, have ERs, etc. And that's the challenge too, is obviously we're mostly aware that hospital, when I say hospital, I tend to mean something specific, but unfortunately there's no rule about what facilities can call themselves hospitals. So y'all will note that when I search St. John's, I kind of get a glut of information that could be helpful, but makes me a little nervous, right? It makes me nervous to see skilled nursing facility, and then in the same location, general acute care hospital. Generally, that's the one I would go with, acute care hospital. If you see that label, that tends to be kind of the money. But this is nerve-wracking, because what if I select the wrong one of the right options and it says yes or it says no? What I actually wound up doing was selecting more than one. And that's exactly what it did. It said no to some and yes to others. And that was very disquieting for me. But what I did figure out was when I was more accurate with the name, when I added, and again, I'm not from this area, so I was just sort of basing this on my own internet search. But when I added HSH St. John's Hospital instead of just St. John's, when I did a little bit more work, it gave me one option. And that felt good. Now, I still double checked it over and over, but this is something just to be aware of, that when you're using that healthcare.gov tool, it's a tool that's pulling information from third-party sources. The better the information you put in, the more theoretically better and theoretically accurate the output would be, but still never rely on it completely. Always get a second way of verifying. I also wanted to recommend, so if your first way of trying to figure out which plan is in, which company is in network with which specific hospital, the other way to go is to actually use the provider directory of the company. So here I'm in Blue Cross Blue Shield. I've clicked on the plan in that plan details button to get more into the nitty gritty. Note that if I'm distracted by that initial highlight section where it says medical providers in network and it says add medical providers, that'll just take me back to this noise. So don't do that. You need to scroll to plan documents until you get that provider directory. And this then will take you to the company's website, which is going to be theoretically more accurate than healthcare.gov pulling secondary information through the website based on what you answered to their website, if that makes sense.
Hi, Ari. So sorry to interrupt, but just wanting to flag 10 minutes remaining in the webinar and 5 minutes until we do another quick and short Q&A.
Crap. Thank you. Excuse me.
Of course, but continue.
Be aware the provider directories have their kinks as well. So note that it automatically populated Chicago. I wasn't looking for Chicago, and that can be a problem. So anytime you move to a provider directory, just be aware it's going to have its own problems. Note that once I actually did indicate the correct zip code, I was able to just use the website's hospital search. And that was kind of great. It pulled up the 2 hospitals, but it also pulled up 2 dialysis centers that are not hospitals in the sense of what I was trying to look for. So here you can see how I built that into my overview down at the bottom. Okay. Sometimes a company will offer multiple types of plan in one market, and you can see how this was so hard that I actually wound up doing some of this for the market in which it happened, because these all seem to have basically the same name, and they all are in network with a different set of hospitals. So that required working very specifically with the provider directory to ensure that I'd selected the appropriate plan name. So not just the challenge of the Chicago zip code, but also the challenge of making sure I had indicated which Blue Cross Blue Shield Chicago plan I was looking into, because it was different for every single one. So this isn't going to happen in all markets. And sometimes, very nice, Florida offered 3 plans, Ambetter offered 3 plans in Florida. They all had the exact same network, and that was lovely of them, but also kind of confusing for the client. And finally, the provider's website is a wonderful potential source of information. If you're confused about whether a hospital is in network with a certain plan, I was so pleased to go randomly to this Florida hospital, go to their accepted insurance page, and then find that they had a whole section dedicated to healthcare.gov, and that Ambetter was not listed, which confirmed what I had been able to figure out on Ambetter's website itself. Okay. Quickly, because this is the part I want to work on further. This was something done for Oklahoma last year. Oklahoma's market is a little bit more reasonable in terms of numbers when it comes to compared to, say, Florida's or Chicago's. So it was a little bit easier to start to do a plan overview breakdown. But this is what I've come to decide is too much to expect y'all to work on, unless the plan would be to do it for like the least expensive, 4 to 5 companies, or plans, or whatever factor is strategically determined. But I wanted to just make sure this is something that can be done. It's very, very annoying, but you can go plan by plan and build that resource. This is what it looked like in bronze plans, where you're essentially building your own category of all the plans in a market. But I want to dissuade anyone from doing this, unless for some reason, obviously they have time, which I don't imagine anyone would have time. I want to come up with a less aggressive way to build this type of thing, especially because for silver plans, you have to build 4 versions of it. You would have to build, for example, a one with no cost sharing, which you can see at the top right corner, and then one with 87% cost sharing, which is the bottom corner. So you don't even get to just do it the one time for silver plans. You would have to do it 4 times because of those 4 different plan types that exist. So I think working on a better solution for individual plan comparison is going to be my next step. And here's some of the templates, just so you guys have those for yourselves. Yes.
Ari, before you close out with your contact, we just have one last question for you. Is there a way we can create a mock training tool to practice using the marketplace?
Man, I would love that. I have to think about that, but I have ways that I've done it previously. Let me think about that. We have that person's email address, yeah?
Yes.
Okay.
I can just chime in here real quickly and say that although it is something that we have been asking for a very long time, a sort of sandbox, at least for healthcare.gov, where assisters could go in and experiment with plans without actually connecting to the opportunity to draw actual premium tax credits from the government. That is not something that to this date healthcare.gov has agreed to do. They've got all kinds of concerns about that, but I want to say that we hear you and we agree that a live sandbox tool would be really helpful for everybody.
I think the challenge and the way I always think of it is the application is what people really should be able to play with. And then the enrollment is almost a separate, you know what I mean, looking at different plans. So, but the problem, of course, is whenever you submit something, these are real dollars and real eligibility work that someone's having to do on the other side. But certainly I will think about that. But that's a very that's long been something we've wished for.
And just a quick last question, is there a difference between CAC and navigators? Or the main difference between CAC and navigators?
I would say the main difference has to do with funding, essentially. Navigators generally are receiving federal funds and certified application counselors generally are not. Typically, they're locally funded or they have some other funding source. But the requirements, I think, are at this time pretty much the same, unless I'm remembering that wrong. There was a moment in time where they had slightly different requirements, but
they do have slightly different requirements in the federal regulations, but another distinguishing difference is that certified application counselors are often based at community health centers, whereas, and they can be based at other organizations, but a large contingent of CACs are housed or affiliated with community health centers, whereas navigators are typically, they're funded, as you said, Arianna, in a different way. And they have more thorough training requirements than CACs do.
Awesome, thank you both. I think we can move on to closing out the presentation for today.
am I supposed to do something?
Sorry. No, I thought you were going to say your contact, but that is fine. I will close this out.
Oh, wait, don't forget.
We will be distributing the materials from today's session via email, and we will post everything to the Beyond the Basics website at healthreformbeyondthebasics.org. Our fall webinar series will kick off with determining household and income, and that is scheduled for Tuesday, September 12th at 2 p.m. Eastern Time. You can register for this and other upcoming webinars on our Beyond the Basics website under upcoming webinars. And just a reminder that if you have any questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we will bring this webinar to a close. Thank you, Arianna, and thank you, Jenny, and thank you everyone for attending.
Thank you.